I think America's getting wise to these games, and it's going to backfire. Yeah. Unless these companies change their methods, they're going to be out in the cold.
Behind that curtain is corporate America dictating healthcare, because they're doing it through what's covered by insurance. First, they're telling people, buy your insurance. It's so expensive now that employers now the employees have to pay part of their insurance. So now they feel like they're paying for their insurance, and they feel like, I want to get my money's worth, so I want to do what's covered by insurance. However, what's covered by insurance is dictated by corporate America behind the curtain, and that is things that don't get people better. We run into this all the time, which is, I love what you're talking about, but I want to take advantage of using my insurance. And what we've learned at AMI is that we love to say, good news. When we give a treatment plan, we teach our doctors this, which is, hey, this is what we think is going to actually get you better. It's a mix of some insurance and some cash, but we always say, good news, your insurance is going to pay for part of this. Now the patient feels that they paid for insurance and that's engaged, but their care is no longer being dictated by the man behind the curtain.
Right.
Yeah, so that's, to me, such a win for AMI
clients. And the ability
clients
to learn how to do that is thrilling for me to teach. And I teach it, and people learn it, and they come back and say, oh my God, it actually worked exactly the way you said it would. And they're collecting things that they wouldn't believe they could collect. It's funny because there are some insurance companies that are a bit nefarious when they say they have chiropractic coverage. We've seen examples of states, and I won't say the exact insurance companies, where the insurance company says, oh yes, there's chiropractic coverage, and they'll cover up to $60 a visit, but there's a $50 copay. The doctor can't live on a $10 payment, and the patient's not going to want to pay a $50 copay.
What happens is they come in and they pay $50, and then the next day they come in, they have to pay $50. Now these people live paycheck to paycheck, a lot of these people. And by the third visit, they're driving by saying, I really need to go to the store and buy for dinner. And then they go buy dinner instead of coming in the office. And then what happens is they don't get the care. So the man behind the curtain, this is a trick, right? The man behind the curtain is playing this, which gives the illusion, I'm buying insurance, I'm paying for part of my insurance, I have chiropractic coverage, and all of a sudden the chiropractor's the bad guy. I'm not going in the office because he wants $50 from me. So that's how the whole thing got positioned, which was just so wrong.
We've seen insurances that went to a capitation of chiropractic care, $60 a visit, let's say, and then now after that got accepted over a couple of years, now they're coming in and saying, and there's going to be a bigger copay. Or there's going to be a bigger deductible. So
or limited visits.
Or limited number of visits. So when it comes down to it, the coverage they're giving for chiropractic care is not in the thousands or tens of thousands, it's in the hundreds. And who could live on that?
Totally. You
look at surgery and how many tens of thousands or hundreds of thousands of dollars that can cost, depending upon what you have to have done. And you compare that to a chiropractor trying to fix a herniated disc. And when I ask that question, how many of you fixed a herniated disc? And 90% of the room raise their hand. And how much you get paid for it? And most common answer I get is less than $3,000.
Wow.
That wouldn't even pay for the anesthesiologist to put the patient under for the surgery. I think America's getting wise to these games, and it's going to backfire. Unless these companies change their methods, they're going to be out in the cold.
But it comes down to this, Mike. If there's nowhere for these patients to go, then they're in the system, no matter what. They want something different, which takes it to AMI. We help doctors put healthcare practices together, healthcare teams together, who can treat patients functionally and tell patients this is exactly what you need to handle your problem. And good news, your insurance pays a piece of this, which is good news for them, but the rest of it is cash, and you figure that out. So unless there's enough offices on the ground to offer the solution that they want, they're going to continue to buy the old product. And that's where we say, for our mission and our vision, is to have enough doctors with this model, because we truly can change this landscape. The time is now, as you said. The time is now. It's time for doctors to be able to integrate to really make a difference in their communities.